is, the MSI-High or deficient mismatch repair subset of metastatic colorectal cancer. So 4 or 5% of metastatic colorectal cancer, so a smallish subset, but a group that consistent data has really demonstrated great immune therapy activity. And so we've seen data with pembrolizumab, anti-PD-1 single agent, Nivolumab, anti-PD-1 single agent, both demonstrating great activity. We've also seen the combination, so Nivolumab plus Ipilimumab, an anti-CTLA-4 combination, really showing kind of dramatic benefit as well. And so there's been a very large study, the CheckMate-142, that had the largest cohort was the combination arm, so 114 patients treated with that combination, MSI-High metastatic colorectal cancer, kind of refractory setting, that really demonstrated kind of remarkable results, and 50% kind of response rate, progression-free survival that really appears very kind of consistent, and at a year is around 70%, and appears to be kind of stabilizing. And so really this high level of activity that appears durable, so very exciting. The CheckMate-142 had another cohort frontline that was presented at ESMO 2018 that is actually looking at the same thing, the combination for frontline patients. So really kind of, can we actually give the therapy in frontline? So that was a single arm study really demonstrating similar activity as you saw in the refractory space in frontline patients. And so I think it's an exciting combination that we have data kind of across all lines in colorectal cancer. In the frontline setting, we don't have any randomized studies at present, though there's a large pembrolizumab versus standard of care study that's completed that potentially will read out this year or next year that may help kind of set the standard for frontline and with a randomized study behind it.